Live in Western Oregon, this is NBC 16 News at 5.
New numbers show 3.8 million people filed for unemployment last week, making that over 30 million unemployment claims nationwide in the last 6 weeks. Good evening and thanks for joining us for NBC 16 at 5. I'm Alan Matthews. In Oregon, more than 362,000 people have filed for unemployment. Taking a look at a bar graph, last week the Oregon Employment Department received 28,500 claims. That's the lowest since we have seen since Governor Brown announced the stay-at-home order. That number has been decreasing since we saw a surge of more than 88,000 claims the week of March 28th. The majority of the claims are still coming from restaurant and retail stores. We first told you about the frustration that some local independent contractors are having over the lack of unemployment resources. Now, a week later, the Oregon Employment Department has a new program called the Pandemic Unemployment Assistance Program. This is to help self-employed, contract, and gig workers. Each person will get $600 a week through the end of July. A big relief for Eugene tattoo artist Tony McAllister.
I knew when I'd done the facts, like, okay, that went through, they received it, and I needed that confirmation after all this time that they are actually getting my documentation, adjustments on what you're spending, what you're...
McAllister has been waiting to apply for more than a month. He now has to wait even longer to receive the benefits as his savings dwindle. People can file for benefits online on the Oregon Employment Department website. Coming up at 5:30, we'll talk to him and find out how this process has taken a toll on his way of life. Meanwhile, Oregon's Representative Peter DeFazio says updating infrastructure will provide necessary jobs once social distancing is lifted. Earlier this year, he proposed a $760 billion plan to invest in infrastructure across the U.S. He mentioned the need for newer and more eco-friendly transportation, but now with the pandemic, DeFazio says the investment in infrastructure will supply crucial jobs.
And this would be the best possible economic stimulus we could provide. We're going to be something like the Great Depression when we come out of this, and we are going to need an economic boost. The U.S. didn't come out of the Great Depression until World War II and the industrialization. I don't want a war, but let's do it with civilian investment.
DeFazio says his plan did not originally have support from President Trump or Senate Majority Leader Mitch McConnell, but he says that they've begun discussing it again. Oregon state parks remain closed, and there is no concrete date for when closures will lift. Camping and day-use reservation cancellations have been extended until at least May 25th. However, NBC 16's Kelsey Christensen tells us that there could be a break coming soon for some of us.
If you've been gearing up for the family camping getaway, you might want to hold the reins. State parks closures due to coronavirus restrictions have been extended. Camping and day-use reservations are canceled until at least May 25th.
That doesn't mean that we're open for camping on May 26th. That means we haven't made a decision yet, and that decision will come before that date arrives.
But there seems to be a brighter light at the end of the tunnel for park goers. Some day-use parks could be opening back up soon.
We're working really hard with both the governor's office and all of our external partners to get day use opened up in a limited way.
There's just no concrete date yet.
There are really popular areas on the North Coast that are simply not going to be ready at the same time places in the Valley or Eastern or Central Oregon might be.
And those parts of Oregon should be prepared for a different experience.
That means you need to prepare a little better. Bring your own cleaning supplies, your own food, make sure that you're staying close to home and not traveling really long distances in order to get to a park.
But many people have asked, why can't I go to state parks if I just keep my distance? Here's why.
It has nothing to do with what you can do as an individual when you're out. It has to do with the effects of travel.
So when exactly will it return to normal?
I'm sorry, I can't give you a real clear answer. When will camping return? Just don't know. And anything that I say now probably wouldn't be good next week anyway.
Reporting in Eugene, I'm Kelsey Christensen.
Blaine County public health officials are encouraging providers to approve more coronavirus testing. Previous guidelines encourage physicians to order tests for those who are seriously ill or for people who have been in contact with a coronavirus patient. But now health officials are guiding local providers to order tests for patients with coronavirus symptoms. Their goal is to get testing up from about 150 to 500 tests a day.
And the way that we improve that is by people with mild symptoms approaching your provider, your medical provider, about getting tested. We have been communicating with our local provider community about the fact that the guidelines have changed, and now people who have mild symptoms should be considered for testing.
No new cases were reported today, keeping the total at 50. 31 people have recovered. 17 are currently recovering at home. And now turning to coronavirus numbers across the state of Oregon. We are currently looking at more than 2,500 cases and 103 deaths. Despite those numbers, only 578 of those cases are people hospitalized, and less than 200 of those people are hospitalized are in intensive care or on ventilators. Cases in our region looking fairly low. Benton County did add a case. They now have 30. Linn County added 4 cases, making that a total of 86 cases. Here in Blaine County, we remain at 50 cases for the 7th day now. Deschutes County added a case, bringing their total to 76. Douglas County stands firm with 23 cases for 14 days in a row. 17 people have recovered there. Meanwhile, cases in Coos County have jumped to 21 as coronavirus continues to spread at the Shutter Creek Correctional Institute. 19 inmates and 2 staff members have tested positive. Well, living in times like these, there are many questions to be answered. NBC 16's Kelsey Christensen sat down with Blaine County Public Health Officer Dr. Patrick Luedtke answering those questions.
I'm sure that you've seen it. 2 doctors, they had a YouTube video saying that they believe that restrictions should be lifted. Curious what your response is to that, medically speaking.
So if it's the video that you're talking about, I watched an entire hour-long video from 2 doctors down in California.
Yep, that one.
They were emergency room doctors. And they made a couple good points in that video, but they also had some real challenges in their interpretation of the data. So for example, while they are physicians and they say that they have microbiology and immunology training, it's pretty clear they didn't have epidemiology, statistics, and public health training. They confused some core items that we look at in public health when we think about a community-wide response instead of an individual one-on-one doctor-patient response. They confused incidence and prevalence. Those are key items in public health epidemiology. They confused quarantine and isolation. And then what I thought was really most interesting is some of the sound bites that they used. So for example, if you watched it, you will remember one of the doctors saying, millions of infections, small amount of death. Well, the U.S. hasn't even passed 1 million infections yet, and we already have 60,000 deaths. In a typical flu season, we get between 20 and 50 or 60,000 deaths, but we get that over the course of the whole flu season, which is October to April. We've had 60,000 deaths in less than 90 days.
One woman reached out to us. She was wondering how come certain places are testing for fever with coronavirus, whether you can come in or not, when not everyone presents with a fever who has coronavirus.
Well, I think that's a good point, but fever is one of the common presentations that you get with this infection. Not everybody gets it. And you can't test for everything, right? So you do what you can do.
And that was Kelsey Christensen reporting. With recent workers at an Albany frozen food plant testing positive for coronavirus, OHA and the Oregon Department of Agriculture made clear there is no evidence of coronavirus transmission through food or food packaging. They say there is no need to recall any food products from stores if someone on a farm or in a processing plant tests positive. OHA and ODA is working with the CDC and FDA to make sure grocery stores and distributors are following orders on how to protect customers and employees. Well, happening tomorrow, Oregon is relaxing restrictions on non-urgent medical procedures, and that includes the dentist, but only so long as they can meet certain restrictions like having enough PPE and following CDC guidelines. Not everyone will open, though, so make sure to call your healthcare provider to find out their plan. An apartment fire in Eugene this morning is still under investigation. Eugene Springfield Fire say the fire broke out around 2:30 a.m. on North Adams Street. Firefighters say the ground floor of the apartment caught on fire and spread to the second floor. The cause of the fire is still unknown. Eugene police are looking for additional victims in a sex assault investigation. Last month, 48-year-old John Paul Powell of Eugene was charged with rape and sodomy. Police say these charges are related to a case involving a minor that happened in August of 2019. Anyone with information is asked to contact Eugene police. The University of Oregon has extended their decision deadline until September 1st to ease some concerns from students and parents. The extension applies to all high school seniors who have been admitted to the university, and that includes those who have already committed to enrolling in the fall term. Meanwhile, you can expect more normalcy this fall with plans for students to head back physically to campus for the fall semester, and that includes continuing to take precautions to safeguard everyone from the coronavirus.
You know, there's so much going on with the coronavirus and families. Well, all of us have had our world just turned upside down in the last couple months. And there's lots of stress about our professional lives and working remote, sheltering at home, and trying to figure out our personal lives.
In response to the start of the coronavirus pandemic, students at UO have been learning remotely in order to finish the spring semester, and the summer semester is set to be the same. Now, coming up on NBC 16 at 5:30, NBC 16's Angelina Dixon will join us in the studio with one way the University of Oregon is giving potential ducks a campus experience while staying at home. A Springfield hospital is the first in Oregon to launch a baby safety system that captures digital newborn footprints. The new baby ID system was started a week and a half ago at McKenzie-Willamette Medical Center. The technology is designed by Certiscan Technologies based in Connecticut. Nursing supervisors say the system allows the medical center to capture high-resolution newborn footprints. That information becomes vital in situations like baby abductions or other crises.
Nobody wants to think about the outcomes of why we would ever have to come back and use it, but we try to just answer their questions and teach them that the safety in the future.
Kim Snauer of McKenzie-Willamette says families have the choice to opt out of using the service if they want, but it has garnered the attention from the National Center for Missing and Exploited Children.